My name is Michelle Rice and I work in the Park Clinic in Cabinteely in South County Dublin.
Michelle, with access to the internet obviously commonplace these days, more and more people, would see themselves as more informed, I suppose, about medical matters. What would you see as a GP are the pros and cons of this?
As a GP, I welcome people being interested and informed about whatever medical problem they have. I suppose there's two aspects of it. One is whether they come informed with a disease they think they have, or whether they're informed about a disease they actually have. A lot of people come to us having printed off reams of information from the internet and have worked themselves up into a state of high anxiety thinking they have X, Y and Z, whereas probably in reality they have none of the above. So what I love, I suppose, is with patients is to get what their symptoms are, talk through the possibilities, and if there's a particular diagnosis or whatever, then I would encourage them to inform themselves over and above what I would have said to them, with access to good internet sites, safe, balanced internet sites.
Are you very au fait, would you say, with the various elements of social media? Do you use them yourselves, and do you find your patients are using them?
I'm aware of them, things like Facebook, Twitter, and various people keeping blogs and that. I have mixed feelings about it. I think there's great potential for them to be useful, especially, say, as support to people who share the same disease, problem, issues, whatever. I think what concerns me about them is the lack of control and what is done with that information. And a lot of it's very personal information about people. And I'm surprised at times at how much people will put up on websites and chat room sites about themselves and their personal details. So I'm wary about the risks associated with them of personal information being widespread and available to anybody and everybody. But there's the potential for real support when it's appropriate.
Given that obviously a GP's day and given week is very, very busy, how do pharmaceutical companies interact with you? Do pharmaceutical companies, some of them do things better? Do some of them connect and interact with you in different ways? And I suppose, who does it best?
Yeah. In our practice here, we have an arrangement whereby, bar Monday, because that Monday's really hectic, we'd have a slot, an appointment slot given over to a pharmaceutical rep, 4 days of the week. And so people would book into that slot maybe 2 or 3 months in advance, and we'd see reps 3 or 4 times a year. The people who would do best tend to be people who connect with us on a personal level, who aren't going to bombard us with legions of statistics, because all of the reps have their own statistics which prove that their medicine is better than anybody else's. So people who engage with us and maybe seek to meet our needs, our prescribing needs, are the reps who will, I suppose, be welcomed back more and more often.